Hey guys, welcome to episode 73 of the Tiny ADHD Superpower. Today's topic is on ADHD and brain scans. Research shows that individuals diagnosed with ADHD have altered brain structure compared to those without ADHD. The brain of a child with ADHD matures more slowly, and certain areas such as the prefrontal cortex, cerebellum, hippocampus, and the amygdala are smaller in volume than that of a typical developing children. So what does it mean when your MRI shows white matter? White matter lesion, visualized as hyperintensities on the MRI scan, signify abnormal myelination in the brain and serve as a marker for small vessel disease. These are considered the marker of small vessel disease that are numerous non-vascular causes as well. And that is related to ADHD that I talked about in earlier episodes. So can ADHD show up in the brain scan? The research is debatable. So what I found is that unfortunately, no, not really. But unequivocally, no brain imaging modality such as MRI, SPECT scan, TOVA scan, or other can accurately diagnose ADHD. So the differences seen in the ADHD brain scan are brain structure, cognitive function, and neurotransmitter activity, which I will go into in a bit. A study on the brain anatomy of ADHD indicates that individuals with ADHD exhibit changes in the maturation of certain areas of the brain, including white matter fiber bundles, gray matter density, the middle and superior temporal gyrus, and the frontal lobes. These structural differences may contribute to the distinct behavior and cognitive symptoms observed in individuals with ADHD. So let's delve into the different types of scans. It's going to be a little bit long, so you can fast forward if you want to know different other scans. So first, MRI scans. Do ADHD brain look different on MRI? It shows differences in the brains of people with ADHD compared to those without. Specifically, certain brain regions have been observed to be hyperactive and others hypoactive in individuals with ADHD in comparison to those with normal brain scans. This implies that there is a variance in the neural activity level between individuals with ADHD and those with normal brain scans. However, the differences are often subtle and may not be easily visible, such as size, connectivity, cortical thickening, and white matter volume, as well as different types of MRI that you can actually see on the MRI scan. Brain MRIs can be used to identify ADHD and distinguish between subtypes. They can also be used to study prenatal factors that may increase the risk of ADHD, says one research. So there are debatable researches and contradictory researches. Now, next is fMRI scan. This is interesting. It's kind of new, not new, but it's called functional MRI. And the functional differences in ADHD brain involve increased activity in certain areas linked to hyperactivity symptoms, as well as decreased blood flow to prefrontal areas. So that can obviously affect the executive functioning. So, using the fMRI, a type of brain imaging that provides a visual representation of a brain's activity, can be used to compare the brain's function to those with and without ADHD. An fMRI can help scientists compare the brain function of people with and without ADHD. However, it doesn't mean that it can actually detect proper ADHD. Lastly, we have PET scan. A position emission tomography PET scan is not currently used to diagnose ADHD. But while PET scan can provide valuable information about brain function, they don't capture the subtle neurochemical processes that are involved in ADHD. However, can a PET scan diagnose ADHD? The interpretation of brain scan result requires expertise and context. It's not possible to equate a particular brain pattern or system observing MRI or PET scan to ADHD. Now, last one that I'm going to go into is the most interesting one. It's SPECT scan, SPECT. It's called single photon emission computed tomography. It's a nuclear medicine imaging technique that can help evaluate brain activity and blood flow in people with ADHD. So how does it work? A radioactive isotope is injected into the patient, and a camera rotates around the head to capture images. The scan shows areas of healthy activity, too much activity, or too little activity. Amazing, eh? What can it show? In people with ADHD, SPECT scan can show the decreased blood flow in the prefrontal cortex, affecting executive functioning. The benefits of a SPECT scan can help people with ADHD understand that their symptoms are biological and not a sign of personal failure. This can help reduce feelings of shame, guilt, stigma, blah, 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 blah. But the cost of a SPECT scan can cost over $1,000 without insurance per scan. However, the accuracy with this three-dimensional threshold SPECT scan are more accurate than conventional SPECT scan for detecting ADHD. So, lastly, I will consult my psychiatrist or psychotherapist regarding more scientific evidence-based information directly from my psychiatrist on different scans, which I also want to know as well. I will reveal these secrets in the later episodes. Thank you very much, everyone. Take care.